college student gets an unexpected roadblock on his path to graduation. Coming up, we break down the rare disease that required an intense, pinpointed cancer treatment to get him back to a healthier life. Good morning. It's Thursday, December 8th. I'm Jessica Lovell. Welcome to the Morning Medical Update. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. A non-cancerous tumor was threatening 23-year-old Alex Teeter's brain and spine. We'll talk with Alex and find out how he's doing months after starting treatment. Oh, and that treatment was offered at only one place in the entire state of Kansas. So make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. But first, we are making our morning rounds today. As you may have heard, actress Kirstie Alley died after a brief battle with colon cancer. That was just recently discovered, actually, according to her family. The 71-year-old Kansas native was probably best known for her work on the hit TV show Cheers. Her sudden death from the disease had many asking questions about the timing of her diagnosis. We are joined now by medical oncologist Dr. Raed Al-Rajabi. Dr. Al-Rajabi, colorectal cancer is the second most deadliest cancer in the U.S., but it can be difficult to diagnose. Why is this?
Well, early on, colon cancer is mostly asymptomatic. You may have very, very limited signs that it's even there. A lot of times it can be pretty advanced if you're starting to feel something related to the cancer. That's why screening is so important to catch colon cancer very early.
So we don't know Kirstie Alley's medical or family history. You, of course, didn't treat her, and we certainly don't know if she was having routine colonoscopies and screenings. But let's talk about the screenings. If there are no underlying risks, you get your first one at 45. Now it used to be 50, now it's 45, and then every 5 to 10 years after that. So why so much time between screenings? What have we learned about the length of that time between screenings and what happens in between? How can you double check and make sure everything's okay?
Of course, that seems to be a long time, but we did studies looking at polyps and their development, and it took an average of about 10 years for polyps to develop into cancer, and that's why the standard recommendation is about 10 years. But there are patients that have higher risk, and that should really be determined by their gastroenterologist and their primary care physician. There are patients that require colonoscopy pretty much every year. Some need it every 3 years, and some, of course, also need it every 5. So it varies depending on your risk, but the standard of care is 5 to 10 years based on what we know about polyp development.
So do colonoscopies find everything? Dr. Al-Rajabi, I had mine last year, or actually this year, 47. So am I in the clear till I'm 57, or is there anything I need to be doing in between? I mean, is there something that could have been missed?
So a very good quality colonoscopy studies have shown that they're very sensitive and specific in catching precancerous polyps and early stage cancers, not only diagnosing advanced colon cancer. So it's colonoscopies, if done right and taken adequate time to evaluate the colon, they are very effective. Now, we are looking into more broad-based polyps that could appear normal and very indistinct from the colon wall, but there are technologies that are being developed in identifying these polyps a little bit more and catching more patients, but they're very effective ways of screening and preventing colon cancer.
What about those at-home tests? Are those effective?
Yes, some of them are. We used to use stool samples to detect blood in the stool, but a lot of times there are newer technologies now actually looking at cancer DNA in the stool, which are very sensitive to picking up colon cancer, but they are not really good at picking up polyps yet. And eventually, if they're positive, you still would need a colonoscopy to confirm your diagnosis. So, the gold standard is a colonoscopy.
So Kirstie Alley's family said that she died shortly after her diagnosis. What does that tell us about her case? Is it fair to say she was stage 4?
It's very hard to speculate in this situation, but there are very aggressive forms of colon cancer, but there are some severe complications. If this was missed or was very advanced, you could potentially develop an obstruction that could sometimes cause perforation of the bowel, very serious infections. If it was very advanced, it could have involved another organ, causing the organ to fail. But it's really hard to speculate what happened. But you could potentially, it most likely could be a very advanced case of colon cancer.
Dr. Al-Rajabi, last question. We know, and we've talked about this, how we're learning that people are being diagnosed younger and younger with colon cancer. If somebody is not quite to the screening age of 45, what symptoms might they have that they need to come see a specialist?
It could be as subtle as change in your bowel habits or your stool characteristics. I know, with our diet, things do change. You really need to look at and evaluate your stool. I know a lot of us don't do that in the bathroom, but the change in the characteristics is important, and that's a persistent change. Things that go back to normal are pretty much okay. Persistent blood in the stool, of course, is a big one, but sometimes you have bleeding on the right side of the colon. You may not detect that. Constipation or the frequency of your bowel movements is also important. If you're chronically constipated and you've tried corrective measures and it persists, I think that's a very good sign that you need to be evaluated. If you're having a checkup or have gone to a health fair or something like that, and they mention that you're anemic with no evidence of bleeding, that's a very good sign that this needs to be evaluated. Of course, there are other subtle signs like fatigue, abdominal pain, cramping, and weight loss, unintentional weight loss. Those could also be signs of something brewing or potential colon issues.
All right, never miss your screening. Thank you for normalizing, Dr. Al-Rajabi, that it's okay to go to the bathroom and take a look. It's okay, right? Always good to see you. Have a great day.
Great to see you. Thank you for having me. Thanks,
okay, we'll see you soon. Well, today we check in with one of the first proton therapy patients here at the University of Kansas Cancer Center. Alex Teeters was a typical college student until news hit that changed his world.
A diehard K-State fan, you'll never see Alex Teeters or his girlfriend Ashley show up for his proton beam therapy wearing anything but Wildcats gear.
And anything KU related, I make sure to wear something K-State.
Thanks to the pandemic and a horrifying diagnosis in March of 2021, Alex is a 6-year senior, but he's hoping to soon graduate with a bright future ahead of him, thanks to his care team here at the University of Kansas Cancer Center.
I studied physics in college, so I have a pretty good understanding of how all the radiation stuff works, and the proton therapy is really cool. It doesn't have as much risk factors for someone as young as I am.
At only 23, it's safe to say Alex was stunned when he suddenly got sick with something that has a very complicated name, myxopapillary ependymoma.
It's basically slow-growing tumors in my central nervous system, starting somewhere in my spine, and then they can go all the way up into my brain.
One night at work, his feet started to go numb.
And so I go home early from work, seeing if I just need to lay down for a little bit. Then when the rest of my lower body started getting numb, I decided I should probably go to the hospital for this.
His girlfriend Ashley drove him to the ER in Manhattan, and from there he was sent to Topeka, where they did an MRI, and from there he was life-flighted to the University of Kansas Cancer Center, where the experts here diagnosed him.
I have grade 2, so it's technically not cancer, but it's treated exactly like cancer.
The treatment? Post-surgery, it was proton beam therapy, 5 days a week, 6 weeks straight.
They're irradiating my whole central nervous system, so my entire spine and my entire brain. But if I did the traditional radiation, the radiation beams would go straight through, posing risks to my heart, my lungs, all that. The proton therapy just doesn't have those risks.
Even though Alex and Ashley are diehard K-Staters, they say they will forever have a soft spot for the health system with their rival's name on it.
The neurosurgeon team and this team here, I feel like they're doing the best they can to help him. It's just really amazing to see how far he's come.
The most nervous I was when they told me I had tumors, and I had a huge sigh of relief when they told me they were sending me here. I don't know if I would trust any other hospital as much as I trust this one.
And we are pleased to welcome Alex, our Wildcat, to the program today, along with his physician and our medical director of proton therapy, Dr. Ronnie Rotondo. Good morning, Alex. How are you?
I'm doing all right, doing pretty good.
Good to see you, Dr. Rotondo. Always good to have you.
Thank you.
Thanks for being with us. Alex, your last treatment was in June, so tell us how you're feeling today.
I'm doing a lot better. I no longer walk with assistance. I can be on my own. I've been going back to work, getting back to normal.
Well, we love to hear that. Dr. Rotondo, explain how proton therapy works and why this was such a good fit for Alex, those who may not understand exactly why this is such an intricate type of therapy.
Right, so proton therapy is a type of external beam radiation therapy. And the main difference is, unlike conventional radiation or X-rays, proton therapy uses particles, protons, which have mass and charge, and so they interact with the tissues differently than X-rays, such that we can actually control the depth at which the radiation travels. And so unlike X-rays, where if you have a beam coming in through a certain direction, the radiation continues to cross through the tumor and out to the other side, with proton therapy we can really deliver the radiation in a much more focused, precise manner, and really try to limit the radiation to the target or the tumor, and limit radiation to surrounding normal healthy tissues, which in exchange can significantly reduce both acute effects and long-term effects and impact the quality of life or improve quality of life. So for Alex's case, as he mentioned, he required craniospinal irradiation, which is radiation of the entire brain and spine. And so historically, using X-rays, there would be a lot of exit dose that would go into the thoracic cavity, so heart, lungs, esophagus, into the abdominal cavity and pelvis, so bowel. And with proton therapy, it was really the ideal and oftentimes considered, the kind of the prototypic case for proton therapy, or where proton therapy shines, because the difference really is dramatic, and we were really able to effectively treat his tumor while really minimizing radiation exposure to all of those healthy organs and tissues.
Causing damage, unnecessary damage. Alex, so take us back to when you weren't feeling well. Tell us about what caused you to go to seek a specialist. What was that like? And tell us what it was like when you heard your diagnosis.
When I heard my diagnosis, I was in the middle of rehab, getting back on my feet. So I was expecting worse news. I was expecting worse, and so when I got my diagnosis and it was non-cancerous, it was another sigh of relief. Thankful that I didn't have the malignant or the really dangerous forms. And it's just been, it was just a wild ride back then, and I don't remember it too great, to be honest.
Well, that's okay. So, but do you remember the treatment itself? Do you remember proton therapy?
Yes.
What was it like for someone? We've seen that. We've gone into the room where people are being treated. Tell us what this was like.
It wasn't too bad. It takes a long time to get lined up, so you can be super precise. When I was starting treatment, it would take like an hour to just line up, and then a lot shorter for the actual treatment. And as my treatment went on, I could line up a lot more quickly, and we learned how to do it a lot more efficiently. And then treatment was a lot shorter towards the end.
So, Dr. Rotondo, it was a piece of good news for Alex, as he mentioned, because not only did he not have any cancerous, malignant cancers, but he said it was a tumor. Dare we say just a tumor? But tell people exactly the difference. And that's something I had to learn when I think I actually texted you one time. I said it's a tumor, but it's not a cancerous tumor. So tell us what's the danger of just any tumor in your brain.
So even a benign tumor, depending on the location, can be life-threatening. And so if you think of the cranium or the brain and the spine, that's a confined space, and you have critical structures. So the brain, lots of nerves, and control a lot of important functions, and similarly for the spine. And so, sorry, even if you have a benign tumor, as these grow, they can apply pressure and compression and cause significant neurological compromise, and so it's very important to treat these effectively, and so it was important that we approach this aggressively with surgery to decompress the compression that he was experiencing on his spinal cord and the nerve roots, and then to follow that up with proton therapy to offer the best chance of long-term local control.
I want to put a QR code up on your screen. You can scan it. It'll take you to more information about our proton therapy treatment, about our center, plus you can connect there with a nurse navigator. I wanted to ask, let me ask you, Dr. Rotondo, first. Are you okay? Do you need a water or anything?
Possibly.
Okay. Can somebody bring Dr. Rotondo a water? That would be fantastic. So first I want to ask Alex, while we were getting that. Alex, I want to ask you, how did this diagnosis change life for you? How did you, I don't know, tackle life differently? What's changed, I guess, for the better?
I'm just more thankful for all the people in my life that care about me. Thankful for my family, my girlfriend Ashley, she's amazing. She was there for me through the whole entire process, which made it so much easier on my part. Just more thankful for the little things in life.
Yeah, I hear that a lot. We hear those stories a lot. It changes you and brings a lot of those positive things to the forefront. Dr. Rotondo, tell us how you measure success for someone like Alex. You proton therapy recently brought here to our area, so we're just starting to see these stories and checking in with these patients. Some of our first patients, 6 months, and pretty soon it'll be a year out. How do we measure success with someone like Alex?
So every tumor is different. So there are some tumors, that shrink significantly or resolve, and others that don't change as much. So in his case, the tumors may decrease in size slowly over a long period of time, but for the most part what we're looking for is stability, so no further growth of these tumors. It doesn't mean that because they're still there they're necessarily active, but as we continue to monitor with regular MRI scans, and as long as we see stability or no further growth, then that would be success in this case.
So we talk about the benefits of having our proton center here in Kansas City. Where would Alex have had to go to, and why is it so important to be able to get proton therapy close to home?
Right. So without our center here in Kansas City, he would have had to travel hundreds of miles, so essentially go to another state. So whether it's several states north or south or to the east, but you'd have to travel a long distance. You'd have to relocate for 6 to 8 weeks away from your support network, away from your family, and so really having it close to home is really a game changer, because for many patients and families that's just not feasible. So whether they're caring for children, or they are caring for an elder parent, or for work-related reasons, I've met time and time again patients who would have benefited from proton therapy, but simply could not make the logistics work, and that's really very difficult, obviously unfortunate for them, and very difficult for us as physicians not to be able to offer the best treatment possible for that patient.
Well, as if these patients don't have enough to worry about. And then we've talked about this so much. The treatment can only take you so far, but your support group is so key in your healing, right?
Very important.
I want to check in with Dr. Dana Hawkinson real quick, Medical Director of Infection Prevention and Control, joining us now with a look at our COVID numbers. Good morning to you.
Yeah, hi, how are you?
Good.
So we are doing, the graphic is a little bit different. We have the total on top, so that's the first number that you're going to see. So 65 total patients in the hospital. Again, some of those are recovery. The ones that are recovery are not the 45 active infections that we currently have, unfortunately. So our number of active infections has gone up. It is 45. And what I mean by that is up from the past couple weeks, which has been in the mid-20s to low 30s. So 45 active infections, 5 in the ICU, 0 on the ventilator.
All right, a couple of headline questions I want to ask you about. China loosening some of its COVID restrictions after some historic protests. Good idea?
Yeah, I mean, so this would entail a large, a long answer. They have had that zero COVID policy now for quite some time, and not wanting to get into the political reasons for this. We know that those restrictions are lifting. That is concerning. Depending on what news outlet you look at, you will hear that there is very good vaccination coverage throughout China, and other news outlets will say there isn't. I believe there is very good vaccine coverage as far as the first or primary doses. There is very low vaccine coverage for any additional doses, from what I understand. In addition, the vaccines that they do have there are not as reliable, don't provide it as a good immune response as the ones that we have here as well. So there has been modeling done, and there is a lot of concern. I mean, I think it's good for the people to be able to get out and live, for sure, but there is a lot of concern for morbidity and mortality once these restrictions are lifted. Even one of the modeling predicts about 1.5 million deaths within 6 months if that happens. So we need to keep an eye on it and really hope that the Chinese people stay safe and stay well. And if they still are able to get vaccines, get vaccinated, and any other therapies that are available to them.
A new study found maternal vaccinations prevents flu associated hospitalization among infants. What are your thoughts about that? I remember when I was pregnant and my doctor insisted that I get my flu shot to protect me so that wouldn't protect the baby, but I didn't know that if an expectant mother gets one, it then helps the infant outside.
Yeah, I mean, certainly we know that mother and baby health is so vitally important in that pregnancy period. There have always been concerns for one reason or another about getting vaccines or getting medications during pregnancy. What we have seen now, as far as with influenza or SARS-CoV-2 or RSV, mom can have bad outcomes, baby can have bad outcomes. These new vaccines come down the pike, especially for RSV. We've seen that when mom gets vaccinated, we have good data to support that baby is protected. Same thing with influenza, just as you've been saying, Jessica. When mom gets vaccinated, when you were pregnant, you had to get flu vaccine. Again, for moms that are pregnant, when they get COVID vaccine as well, that is all helpful and has shown to be protective of not only mom but baby, certainly in those first few months of life, because of that active transfer of those antibodies, which is so vitally important, and also just keeping everybody healthy. But the other thing is it has shown to be safe. So I think this is just more data to support what we have known, and we are all concerned again about mom and baby's health. This is one more piece of data to support the fact that if you are pregnant, please get those vaccines, get that perinatal and prenatal care, and get up to date with that. Now, it doesn't only protect you, but does protect baby once baby is born. So.
I have a reporter question for you today from Natalie at the Kansas City Star. We talk a lot about these flu-like illnesses. She's asking, does flu-like include COVID-19 and RSV? Yeah,
so in the CDC data, and we showed a map of the United States yesterday with the purple and the red, and for that, they are looking at influenza-like illness, which is ILI, and what that basically means is people who present for evaluation, whether it's to the emergency department or their clinics, for certain symptoms, and those symptoms are fever plus either cough or sore throat. So that is influenza-like illness, and then you go to break it down to get a diagnosis. So influenza-like illness is just a reason you would present. People do have fever, they do have cough or sore throat, and then you get evaluated. And so that could be influenza, that could be COVID-19, that could be RSV, that could be any number of common cough and cold viruses, rhinovirus, metapneumovirus, what have you.
She also wants to know if you recommend flu or COVID vaccinations for someone who has recently been sick.
Yeah, very good question. So certainly for influenza, it is recommended that you would still get influenza vaccine even if you've had it. Why is that? Because what we have seen is most of the time influenza will have sort of a bimodal distribution throughout the influenza season, meaning that there will be an early surge as we are seeing, and that tends to be influenza A, and then later on you will have influenza B come through. That is not always true, but the main issue is that you can be infected with influenza again after you've had it, and it could be a different strain. So the influenza vaccine does have 4 different strains in it, so it is vitally important that even if you've had influenza, get vaccinated. For COVID-19, it is still recommended that if you've had COVID-19 that you do get updated with the booster if you haven't had it already. And that can be done as early as the 10 days when you're out of isolation or not wearing the mask anymore, so that you don't spread it to those people that are giving you the vaccine. But there is also the consideration from the CDC that you can wait up to 90 days after having the acute illness before getting your booster. So,
Doc Hawk, thank you for that. Natalie, thank you for your questions. Let's get to some questions from our viewers. And we have one from Ruth Ellen. Alex, it's to you. She said, first of all, thank you so much for sharing your story, and just wanted to know what it was like getting back to your studies.
My professors have been great and super helpful, so if they hadn't been, it would have been a lot harder, but because my Department of Physics, everyone has been helping me get through it, I'm on track to graduate the same time as I was before my diagnosis.
Not holding you back. So Joe Ellen wants to know, did you have to commute from Manhattan?
My family is all from Kansas City, so I stayed with family during that time. All my pets are back in Manhattan. Someone was helping take care of them, but I have family, and they were all supporting me through the whole.
And that's exactly what we've been talking about, Dr. Rotondo, just having it right here where he can have his loved ones close.
And I'll say that, certainly we treat patients from Kansas City and proximity, but all of our patients are really evaluated comprehensively when they come to see us, and that includes also a dedicated social worker who's there to help patients. So even if you're 2, 3, 4 hours or from another state, we have resources in place and social to work with you to help you find accommodations and transport and all of that kind of stuff.
That's what we talk about, calling and clicking on that QR code, which will take you to more information about our Proton Therapy Center and get you in touch with a nurse navigator. Nobody's hanging you out to dry. The minute they pick up the phone.
There's a whole team of people here.
Yeah, they're going to carry you all the way through. So it's really it's a good call to make if you think that it's something that could benefit you or someone you love. Fanny wants to know, can proton therapy be used for tumors on the left side of the skull? And why would she ask that?
On the left side of the skull. So I think in terms of laterality, I'm not sure that as significant, but certainly proton therapy can be a consideration for skull tumors. So of course, proton therapy can be particularly beneficial in cases where there are critical structures that are close by, and assuming the skull, the brain, or critical structures there. So obviously we have to evaluate each case independently, but it's certainly a possibility, and so I think if I would certainly reach out and we'd be happy to evaluate the case.
So Lauren wants to know, what other types of cancer or tumors do you treat with proton therapy, or possibly what might be treated in the future?
Right, so proton therapy in theory can treat pretty much quite wide range of tumors, really, from head to toe, and so that can include things like brain and spine tumors, as we've been talking about this morning, and skull-based tumors, head and neck cancers, but also things like gastrointestinal tumors like esophageal cancer or breast cancer, pancreatic cancer, prostate cancer, sarcomas. So it can really treat a wide variety of tumors. And so the key thing is, proton therapy may not be the best treatment for every case, but certainly there are a significant number of patients who can benefit. And so when you reach out to KU Cancer Center and get plugged in with a nurse navigator, we'll evaluate your case and we'll determine what is the best treatment option for you. And if that's proton therapy, then certainly that that's something that we'd help you pursue.
So for someone who didn't have access to proton therapy, what treatment would someone maybe like Alex, what would they have been presented before proton options?
Right. So historically would have been conventional radiation, so photon therapy or X-ray therapy. But as I was alluding to earlier, with that form of radiation therapy, he would have been a significant amount of radiation would have gone to a lot of normal healthy tissues, so things like the heart, lungs, and gastrointestinal system. And so with proton therapy, we're really able to limit that. Of course, we've also referred patients out to other proton centers, but that was not always feasible, as we were saying, for all patients. And so it really opens up access to this cutting-edge treatment to patients, having it right here, and that's why it's so important we did it.
All right, I want to get to our final thoughts from our guest. And Alex, I want to start with you. Just final thoughts or just a good old shout out to the Wildcats. Use your time how you would like.
Yeah, I want to thank everyone at KU Med I want to thank my care team, the team at Proton Therapy. They were all made my experience fantastic through the whole time. And I guess shout out to K-State for Big 12 champions.
Absolutely. We love our Wildcats equally. We do. And Alex, thank you so much again for sharing your story and
Thank you.
Just being a good health advocate. We appreciate you very, very much. Dr. Rotundo, final thoughts from you today.
Well, I think I saw Alex a little while ago, and we're probably due to see him soon again. But it's nice to see him this morning and see that he's still doing quite well. And again, just to encourage people to seek an opinion. We're happy to evaluate your case and see if proton therapy is the best fit for you.
All right, Dr. Hawkinson, I want to get to your final thoughts, but Gene brought up a good question. He's got an eagle eye on this show. He said, did active COVID patients drop from 58 to 45 since yesterday? He says, I'm a little confused with the active and the total. I don't know if we could pull up the COVID count, but I want to explain to people, and I'll let you actually, Dr. Hawkinson, explain what we are showing here and why we are changing how we're presenting our count.
Yeah, and I think he's talking about yesterday as well, and certainly that is one good thing that we need to bring up. That was a mistake in the reporting. That was the total cases yesterday that were reported as active. That has been corrected today. So very good. I'm glad somebody brought that up so we could make that correction.
And we are presenting the total, though, active people in our health system, correct? Because we want to show the totality of people that we are treating with COVID.
Yeah, and I think that is just a horrible conversion of events with, number one, the way that we are reporting, but also the error in our reporting yesterday for those numbers. That included the total as the active, and I believe that is what he is asking about.
Okay, well, your final thoughts today.
I'd like to just echo the thoughts of our guest with rooting on the Wildcats as the Big 12 football champion. Let's keep all of those championship banners and championship hardware in the state of Kansas, certainly for men's basketball. Jayhawks recently won the men's basketball national championship, but also, of course, the Big 12 champion. So I'm going to just kind of echo what he said. And again, I think we had some good questions as well. Continuing to endorse the fact about vaccines. The question about getting vaccinated after infection was vitally important as well. Certainly would continue to recommend that, especially for influenza, because of the reasons I stated. You certainly can be infected from a different circulating strain of the virus, even after you've had influenza in that season.
All right, Doc Hawk, thanks so much. Well, it is Thursday. All Things Heart is coming up at 10 a.m. Host Alexis Del Cid is joining us now with a preview of today's program. Good morning.
Good morning, Jess. Today on All Things Heart, our featured patient also happens to be a KU med school student right here. And she had specifically studied the autoimmune disease that she was ultimately diagnosed with. Yet when she first started experiencing the symptoms, she wrote it off as med school stress.
It was like 2 a.m. I couldn't sleep. My heart rate was just out of control. And I was noticing when I was working out that my heart rate was spiking into the 200s. It got to a point where even taking the trash out, my heart rate would go up to 170 on my Apple Watch.
So today on All Things Heart, we're going to check back with Amber. We're going to tell you about her diagnosis, which is common, by the way, and the risk it could have posed to Amber's heart had she not finally sought treatment, and she got it here at the health system. We'll tell you the symptoms to look out for and what you should do if you have the same symptoms this morning at 10 a.m. So bring your questions, and we will see you then.
All right. Looking forward to it. Alexis, thanks so much, and thank you for joining us today. Coming up on tomorrow's Morning Medical Update, older people have been known to be at a higher risk of death from COVID, but now they make up an even larger share than ever before. Dr. Greg Pullen from the Mayo Clinic joins our experts to explain who is at risk and why. We'll be back here tomorrow at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.